going to talk about today clinical updates in diffuse large B-cell lymphoma. I do not have any disclosures. So I want to try to cover a few things. One is obviously to go over just a background on diffuse large B-cell lymphoma, give you a little bit of idea of diagnosis and what that means. I want to discuss the POLARIX trial, which is the addition of polatuzumab to frontline chemotherapy. And I would like to briefly discuss some novel therapeutics for the relapse setting. And so in general, what is lymphoma? So lymphoma is a type of blood cancer that affects the lymphatic system, which is part of the body's immune system. Lymphoma is a cancer that starts in the white blood cells that we call lymphocytes. In general, we have B lymphocytes and we have T lymphocytes, which have different regulatory mechanisms in the immune system, and they travel through the lymphatic system as well. The lymphatic system is a network of organs and vessels that helps filter lymph to remove foreign particles and microorganisms. So in general, people often ask, what I don't understand lymphoma, what is lymphoma? And, I try to explain that in your immune system, your body is constantly making new cells. The cells are constantly trying to change on purpose in order to fight different pathogens. And what happens along the way is somewhere along when they were dividing, there was a mistake with the division, and then that mistake just kept dividing over and over. So in general, lymphoma can present in a lot of different ways, depending on exactly what type of lymphoma you have. Some people can actually feel swollen lymph nodes, and that's how they get a diagnosis of lymphoma, or they can visibly see them in their neck or feel them in their groin. Some people can have a lot of fatigue or unexplained weight loss. We usually, not like 1 to 2 pounds, but usually you'll see like 15, 20 pounds weight loss in somebody who's not really trying to lose weight. You can have people present with a lot of infections. They say they're chronically getting sick. Some people have drenching night sweats. Sometimes for women who are in the menopausal range and they're having night sweats already, it becomes a little bit confusing and it delays their actual diagnosis because they're already having these symptoms from menopause. Some people can get rashes. They can be very itchy. They can have high fevers. If you have a lot of abdominal lymph nodes in the stomach or enlargement of the spleen or the liver, you can feel abdominal swelling, abdominal discomfort. And for patients who have large masses in the chest, they can feel, they can have dizziness, they can feel like they're going to pass out, they can have chest pain, they can have palpitations. Any of these combinations can be a normal presentation. So in general, lymphoma diagnosis, the first thing I always tell my patients is do not Google anything because there's, over 70 different types of lymphoma. And whenever you Google something, obviously the worst case scenario always pops up first. So whenever I have a new patient with a diagnosis of lymphoma, I think the first thing to do is understand exactly what kind of lymphoma they have. So in general, I think people have heard of Hodgkin's lymphoma versus non-Hodgkin's lymphoma. Basically, Hodgkin's lymphoma is a very specific type of lymphoma, and non-Hodgkin's lymphoma is just a very broad category that includes a lot of different lymphomas. So as I mentioned before, you can have lymphomas that come from the B-cell lymphocytes or the T-cell lymphocytes. The majority of lymphomas are going to be B-cells lymphomas versus T-cell lymphomas, which are more rare. In terms of both B-cell lymphomas and T-cell lymphomas, you can have indolent type of lymphomas and you can have aggressive type of lymphomas. In general, when we think about B-cell lymphomas, when we think about indolent lymphomas, they don't always require treatment. We usually need a reason to treat them. Either the lymph nodes are very large or the patient's very symptomatic. But we don't usually think of it as something that is curable, other than there are a few nuances to that, obviously. But in general, we think of it sort of more like a chronic disease that is going to have multiple relapses a long time. While aggressive lymphomas are very fast-growing lymphomas, they always require treatment, but our intention is to cure. So obviously, this is not for memorizing or anything, but I just wanted to show you exactly kind of like an example of how many different types of lymphomas you can have. So As I mentioned before, overall, you're going to have more B-cell lymphomas than T-cell lymphomas. We found multiple viral infections that can actually be related to T-cell lymphomas. And you can also see, this is not a comprehensive list at all, but it's just to show you how many different types of lymphomas that there are.